Hi everyone, in today's video we're going to look at sports massage therapy for injured runners. Now it depends on really what your needs are and actually how serious the injury is as to what's going to be the best approach. You could be working with a physiotherapist, osteopath, sports therapist, sports massage therapist, running coach, strength coach or PT. Loads and loads of approaches, and often people will kind of find a bit of a way around it and their own individual methodology to some degree as well. Now, I fall in the middle of kind of all of these things to some degree, although not the high end of physiotherapists and osteopaths, because I'm a sports massage therapist, but I have a background in exercise through PT qualifications, which I gained in 2012, also kind of around the running coaching side, which I've worked in since 2018, and also nutrition as well, which can be a part of this whole factor. So you will find the right person for you. Most importantly, that has to be the case. So it's about communication, and that relationship you have with the person is so key as to actually how much benefit you really get and whether it really works for you. You have to be 100% open and honest with them, telling them as much information as you can around kind of what happened, why you have the ache or pain, or what you think might be going on. Equally, they have to give you a really clear idea of what may be happening, what their limitations may be, and how they can treat you, or if they don't know. And also kind of getting you some active homework that you can do at home. Now, I'm really keen on the homework. That's my personal preference, is what I think should be happening a lot of the time, but also the combination of manual therapy a lot of the way as well. Everyone does have their different methodologies, and there are kind of ways that things tend to be moving, which is less away to a less than manual therapy, because the manual therapy in itself often isn't as productive as it's been made out to be over the years. There are no benefits to it, so it depends on how you're feeling. If it can make you feel better, that's a fantastic benefit. If it can help relieve pain and stiffness, fantastic. Although it's short-lived, if that kind of opens up the next step, then it can still be very useful. My personal preference is getting a bit of an assessment, obviously first off, making sure that things are working well, see what's happening, get an idea of what may have caused the problem in the first place, the various contributing factors, and then going, right, here's how we treat it, here's the method we're going to approach. If we find that that's not improving at a certain point, we'll try something different. Here's kind of level 2, either scaling up those things we're currently doing to make sure we're getting enough load, or that's actually probably not the issue, let's work on something else. Very rarely do we get to stage 2, because usually we hit the nail on the head fairly quickly, and it's maybe just that dose-response relationship. Alternatively, if we do go to stage 2 and I'm out of ideas fairly quickly at that point, then I will refer on to someone like my physiotherapist, Fiona. Now, that approach that's going to work right for you is dependent to some degree on their injury. However, it's really tough to get a diagnosis as such, because you're then going to be looking at some imaging, ultrasound, MRI, or something along those lines. And even then, there isn't a complete definitive, that's exactly what's going on. I've worked with runners who have had scans and all sorts of different things, working with several different specialists who have still been in pain. However, within weeks of working with themselves, we've then worked together really closely, and they were pain-free running or very minimal pain running within 6 weeks. So it is the right approach for you as an individual. No one person will be the best person for everybody. I won't be, and neither will anybody else. That is just part of it. So whatever you do, you want to make sure that you're finding the approach to the person that's going to work well with you. What are your wants and needs? As I've always said, with everything really, but particularly with this. So go into it very open-eyed. Give your expectations to them. Ask them what their expectations of you are, and also talk through really openly what's happened. You know, as you go through the process, if it's not working out as you want it to, if during the manual treatment side you want more pressure, less pressure, there's a little bit of an area you go, that's not quite it, can we just come inside here slightly, or just outside here? Let them know. Be really open. You'll get far better benefit. Whatever you're doing though, if you do get some homework, which you should ideally do in my view, then be sure that you do it. It's really common, it's a bit of a kind of a cliche really now, that physiotherapists, sports massage therapists set you work and it often doesn't get done. Really common. And if it doesn't, fine. As long as you're happy with the result, is you're not putting the work in, not getting the benefit, then that's fine. Sometimes people don't put the work in and the manual therapy and the movement change actually are enough. However, that's rarely the case. So be open and honest right the way through. If you're not doing something, let them know. They can either give you something that's slightly more appropriate, slightly less volume of that, or actually something that's entirely different to make it work for you. And go, you know what, you're not going to do the homework, that's fine, but you need to come in more frequently, or we can get on top of this. That can be a solution as well, depending on your situation with finances ultimately and time. So key thing is though, see somebody. If you've got a problem, don't just keep putting it on the back burner and thinking, oh, I'll get round to that, because so many times I've seen people who have been in pain for months, and then within a couple of weeks they're pain free because they've actually worked on it really quickly. In that meantime, they've sometimes spent hundreds of pounds, sometimes more, on various different types of shoes. I saw somebody last year who had bought 3 different types of shoes because they figured that was their foot problem. We did a couple of bits of work on it. bit of work at the massage ball, some treatment at home, and then some exercises, and within weeks they were pain free. So it really can be something as simple as that sometimes. So don't spend loads of money on shoes and equipment. Go and get a professional opinion of somebody who you trust, who you've been recommended to, who can give you the best advice that you can get at that point, or certainly point in the direction of somebody if they can't help themselves. Anyway, make sure you do get things looked at, crack on with it, keep your running consistent. Consistency is all part of the fun of running and training. Nobody likes being injured, so get on top of it as soon as you possibly can.